So I'm Becca Aaronson. I am the healthcare reporter for the Texas Tribune. Thank you guys all for joining us again for the second panel on our healthcare track. Today we're going to be talking about the Fight Over Medicaid, and we're very happy for our sponsors, AARP, for helping us present this session.
Out of emergency rooms and in the proper settings. I'm willing to talk about copays. And Zerwas's bill had all that as well, and he did take a lot of our ideas just verbatim and put them into the bill, and we were happy to see that. And those are the kind of things we want to talk about, because those are the kind of things that can make a difference. But the problem is, if you and Representative Zerwas and other members of the legislature are willing to talk about that, CMS isn't willing to talk about that. And the rules that govern Medicaid in Washington are the rules that govern Medicaid in Washington. The state has so little flexibility. You can do reforms around the edges to the Medicaid program with waivers, but CMS is constrained by the kind of waivers they can issue the state, and you can't get to the real fundamental changes that need to happen in the Medicaid program, which is to incentivize the enrollees to access care in the right settings. You can't do that without some flexibility from Washington. And so to Mayor Rawlings, to your point, yeah, there's $90 billion on the table, but without flexibility to be able to implement certain kinds of reforms that were in the Zerwas bill, that $90 billion looks good now, but it represents a long-term liability for the state. We have no flexibility to be able to change things in the program down the road to be able to get the results that we want.
Right,
so
Representative Zerwas' bill was dead on arrival. Representative Zerwas' bill was intended to get enough votes from the Appropriations Committee, from Republicans, in order to get to the floor. And the Republicans on the Appropriations Committee that voted for it with a great deal of consternation. It barely passed. It was dead on arrival. Okay? So it wasn't about D.C. The decision was made here in the state of Texas. We are not going to do anything to expand it. I don't care what you look at. I don't care how you design it. If you put it in a rider, which was kind of placed in a rider, the leadership, the governor said no. And it was dead. It was yanked out. So I hear what you're saying. I know oftentimes, and in the state of Texas, we want to point to D.C. as the problem. Take D.C. out. Take President Barack Obama out of the scale. I've been in the legislature since 1989. I've served on the Appropriations Committee for many, many years. When it comes to funding health care in the state of Texas, the leadership in the state of Texas has always been reluctant to fund health care, period. When we started this session, even on mental health funding, we were 51 out of 51. That's not about Obamacare. That's not about ACA. That's about how Texas has looked at the situation, health care in this state. The reason why many people are opposed to block grant funding, our attitude is this. When Texas has had total control of the healthcare system, and you haven't funded it like you should have funded it in the first place, and now we're going to give you a block grant so you can revamp the existing system. What you want to do? Make it worse? How do you go from 51 to 52? So the math doesn't add up. And so as much as we want to be nice, and I think I have, my history says that I will reach across the party line and will go over to try to reach some sort of consensus. But if you are determined that these are people that you don't want to cover, you just don't want to cover them, and even if I accept all of what you're saying and you still want to blame it on somebody else, the reality is you simply don't want to do it. And it's costing everybody in the state of Texas, because you cannot hurt the uninsured without also hurting those who have private health insurance.
With regard to the block grant, I'm going to steal a line from a good friend of mine who says, doing a block grant would be like giving your 16-year-old the keys to a car and a fifth of Jack Daniels. So I completely agree with what you said. And when you look back over the last decade, Texas has filed more waiver requests with CMS from 2292, SB 10, SB 7, SB 8. I can't even count how many we have filed. And to my recollection, CMS has only turned down one of those waivers, and it was under the Bush administration. So, when you look at what the Obama administration's goals are in terms of Medicaid expansion and making it work for the state, a lot of people would argue that they've been overly flexible in trying to work with the states.
Secretary Sebelius told me on Thursday that she will sit down with anybody at any time and try to work this out and say what is right for the citizens of Texas, and she will try to be as flexible as she can be on this stuff. I mean, so it's not like, the point is, we got to get ideology out of here and say, what do we want? There's a good question. Do you want to give those people health care or not? That's the fundamental question. If we don't, that's the decision the state makes. If we do, and it's a problem of how we do it, let's talk about that and really get on. But I think we're kind of talking past each other.